And I'm excited to be with you all today to talk about this topic that is just so immensely important and evolving quite a bit. So without too much ado, just by way of disclosures, I do a little bit of consulting work. None of that has to do with anything that I'm going to talk about tonight. I am engaged a little bit in the community, more in the past probably than at present with NEST and then the Clean Energy Alliance of Naperville, which I think are doing great work, and we'll talk about that at the end probably a little bit. My goal tonight is basically to cover 4 topics. One is I want to talk about the health impacts of climate change, those that are both obvious and some that may be a little unexpected. We'll talk about how climate change is a threat multiplier, which I think is one of the things that we're seeing in Puerto Rico at this very moment. And then we'll talk about how climate change amplifies disease disparities, something that I'm passionate about. And at the end, I'm going to try to leave you with some suggestions as to how we can make the world a better place. All the things that y'all are working on with a focus on how to act sort of locally here in Naperville. So let's talk a little bit about the impacts that are both obvious and unexpected. So what we see with climate change, as you all know, is this rising CO2 levels that feed temperature rises, extreme weather events, and rising sea levels. These lead to a number of different environmental changes, including extreme heat and severe weather and air pollution, that have the capacity to affect all sorts of different diseases, from heat directly to cardiovascular, cardiopulmonary, renal function, malnutrition, respiratory diseases, and infectious diseases. And so this topic as a whole is probably a week-long talk. So what I've decided to do is we're going to just go with a few highlights, just to give you a sense of like some of the most important things that we should be thinking of. But certainly as you think about how climate affects health, I'm sure you'll come up with other examples as well. So first, let's talk about heat. So heat kills, and I think that this is something that is more on the obvious side, and that is that heat by itself is a stressor on human health. So in this case, so heat stroke is defined as the severe form of illness arising from elevated core body temperatures. And importantly, it's characterized by multi-organ system dysfunction. So this leads to disruptions in the central nervous system, multi-organ failure, including lung dysfunction, renal failure, heart failure, that all accompanies this hyperthermia. And the important point here is that mortality for heat stroke is actually quite high. So it's over 50% among the elderly. This is sort of in contrast a bit to exertional heat stroke, which is also in its own right a medical emergency that is specifically related to physical activity, and specifically physical activity often conducted in the heat. This is something that we generally think of as affecting athletes, laborers, soldiers, and particularly folks like firefighters and agricultural workers. And in your own mind, if you're thinking about like, is it possible that I'm having heat stress or having a heat stroke or some type of heat-related illness, what people experience are a series of symptoms that include muscle cramping, fatigue, headache, nausea or vomiting, and dizziness and fainting that can then progress if the heat is maintained to this multi-organ system dysfunction. What's important to recognize is if we look across the years, what we're seeing is a rise in heat waves and exposure to heat waves across the globe. And this includes to populations that are particularly susceptible to heat, including adults over the age of 65 and infants less than 1 year. And what's important here is that compared to this baseline of 1986 to 2005, rates, exposures to heat waves are increased, and they're not increased in any one particular region, but what we see is that exposure increases across the globe. This exposure is related to mortality. So as I said, heat kills. And so this is a representation of global heat-related mortality from 2019. And across the globe, it was estimated that 345,000 people died as a result of heat-related mortality who are above the age of 65 in 2019. And what's important here is that compared to the average from 2000 to 2005, this is an 80.6% higher rate of heat-related mortality. So not only is it getting hotter and people are being exposed to heat waves more, but mortality associated with heat waves is also rising dramatically. This was an interesting paper that I wanted to share with you. So we know that, heat waves happen. Heat waves have happened for all of human history. But what this paper tried to do was assess the contribution of heat-related mortality that could be attributed specifically to human-induced climate change. So what you see here are basically global temperatures. Here is the anthropogenic rise in temperature as a result of human activity. And here is sort of what the expected temperature would have been based on natural forces. And so what this group did is they assessed 732 locations across 43 countries and assessed the mortality burden imposed by the additional heat imposed from human-induced warming from 1991 to 2008. And what you can see here on the left in the spiral diagram, the height of each of these bars is the attributable fraction of human-induced warming on human mortality, heat-related mortality. And so if we look across the entire globe, approximately 37% of warm season heat-related deaths can be specifically attributed to anthropogenic climate change. And importantly, this is not, again, a phenomenon that's restricted geographically, but rather increased mortality is evident on every continent. The impact of heat also affects things like security and economic output. So I just wanted to share the slide on the left, which is basically the rate of heat stroke among active duty service members in the US military. And what you can see is that in recent years, the rates of heat stroke have risen considerably, principally driven by Marine Corps and Army service members. On the right, what you see is the impact of heat on our ability to work. So not only is this heat driving health-related outcomes, adverse health-related outcomes, but it's also impairing economic activity as well. So in panel A, you have low HDI countries, medium HDI countries, high and very high. This is the Human Development Index going from low to very high. And what you can see on these axes is the potential labor lost in billions of hours across the globe from the 1990s till 2020. And while the specific contribution to lost labor varies depending on the development of the country, what you can see is that there's a rise in the loss of labor as a consequence of these rising temperatures. So heat is a threat both to economic security, physical security, and health security. So what about other outcomes? So this may be a little bit less obvious, but elevations in temperature and shifts in climate increase the risk of infectious diseases. So this is a really cool and actually terrifying paper that was published just this year. So this group looked specifically at the effects of climate change on known human pathogenic diseases. And they took into account this framework of climate change that includes the impact of greenhouse gas emissions on temperature, storms, precipitation, drought, heat waves, etc. And so what this group found was looking at the various infectious diseases that are known to adversely affect human health. There are a number of different climate-related changes to the environment that amplify the risk of these diseases. So this includes the impact specifically of warming, of changes in precipitation, floods, droughts, and storms, and other factors. And what's important is when you look at the diseases that are affected, it's not just one thing. I think we can easily conceptualize that warming temperatures lead to the spread of mosquitoes to areas that, may not see mosquitoes that bear things like yellow fever. But what this group found was that myriad different infectious diseases are actually altered by our changing climate. And so when they looked at 375 diseases that are known to affect human health, they found that 58% of these infectious diseases were aggravated by climatic hazards. And in their analysis, they revealed 1,006 unique pathways in which climatic hazards led to pathogenic diseases. This is like an astounding finding in both the number of diseases that are altered by climate change, as well as the myriad ways in which these factors can actually adversely impact human health. And so the important point here that they conclude is that the complexity of these interactions, the numbers of diseases affected, mean that there is an urgent need not to address each of these individually, because such an approach would require numerous comprehensive societal adaptations, but the solution really is to work at the source of the problem, and that is to reduce greenhouse gas emissions. Okay, the lungs are also an important target for changes in climate that can adversely affect human health in a number of different ways. So the most obvious of which here is that air pollution is worsened by climate change. And we know that air pollution is bad for lungs. This includes increased particulate matter air pollution, as well as ground level ozone, which we colloquially call smog. Wildfires are also a special threat to air quality. They release particles associated with asthma attacks, heart attacks, lung cancer, and premature death. And then extreme weather event poses additional risks on pulmonary health. So if one's house floods and it needs to be cleaned up, that storm damage that needs to be addressed increases the risk of exposure to multiple pulmonary toxicants, including molds, as well as toxic chemicals. From an allergy and asthma standpoint, warmer weather prolongs pollen seasons and actually increases pollen levels, while increased moisture from rainfall and floods enhances mold exposure, which can trigger allergies as well. And one of the important points I want to make sure that I emphasize here is that air pollution is one of those things that's not just restricted to adverse effects on the lung. Air pollution is linked to various other diseases, including diabetes, which is what I study, hypertension, obesity, cardiovascular disease, and other factors as well. So the increase in air pollution stemming from climate change is a threat to multiple organ systems and overall human health. In an area that is just now, I think, starting to get sufficient attention is the impact of climate change on mental health. So this is something that has not been adequately addressed in the literature, but new data is coming out that consistently show that climate change is an important threat to mental health. So it's clear from the data that climate change and related disasters induce anxiety, as well as chronic and severe mental health disorders. We also know that flooding and prolonged droughts are associated with higher levels of anxiety, depression, and post-traumatic stress disorder. And extreme weather events are also associated with increased aggressive behavior and domestic violence. So it's interesting to think, and honestly, just frankly terrifying to think about the intersectionality then of climate, health, and violence being completely sort of causally linked. This is probably amplified by the fact that extreme heat may lead to increased use of alcohol to cope with stress, and it certainly increases hospital and ER admissions for people with pre-existing psychiatric conditions and increases the risk of suicide as well. Importantly, psychiatric medications can interfere with thermal regulation, which increases an individual's susceptibility to heat and makes them more vulnerable to injury and death. Indeed, it's likely the case that many of the medications that we prescribe may impair adaptive mechanisms that are required for dissipating heat and withstanding heat stress. And this may be part of the reason that older folks are more susceptible to heat. It's not just age, and it's not just comorbidities, but the medications that we use to treat those comorbidities may also render them more vulnerable as well. And then folks with pre-existing mental health disorders are also more vulnerable. They're more dependent on support services that may be disrupted by extreme weather events. And I'll talk about that a little bit more, because this is not something that's solely unique to mental health disorders, but it's also common to other diseases as well. There are specific populations that also are uniquely susceptible to the adverse mental health consequences of climate change. So we believe that children are more impacted by disasters and more likely to have continued trauma-related symptoms after a disaster, although they may have better longer-term adaptation as a consequence of those exposures, although I think that still remains to be determined. In addition, first responders, those that we rely on to help us get past extreme weather events, are at increased risk for both short and long-term mental health consequences of dealing with those disasters, their own life disruptions, and then the trauma of having to see the adversity imposed by these extreme weather events. And then finally, if we scale up to higher scale, to larger populations, there are larger scale adverse effects on mental health that include the deleterious impact of things like food scarcity, loss of employment and or social support, and population migration. So those are sort of the direct effects, or some of the direct effects. There are myriad others that I just didn't want to waste too much of our time on. But the important thing is that those alone don't fully quantify the risk. And that's because of the fact that climate change is actually an important threat multiplier. So when we think about clinical care, when I'm caring for patients, when we're thinking about how we're helping our patients prevent disease or treat their disease, we often think of two things. So one is nutrition, and the other is physical activity. I think it's somewhat self-evident that increased temperature stress increases the risk of physical activity, as alluded to at the beginning. It also may increases the risk of air pollution and air pollution related adverse events as well. So clearly, increased heat is likely to impair physical activity in important ways that adversely affect health. What may be a little less obvious is the nutritional impact of climate change and consequential food insecurity. So this is on the left, what you see here is a map of the US drought conditions in July of last year, 2021. I don't think much has really changed since then, but what you can see is that much of the West is in very severe drought. And on the right, what you can see is the global land area affected by drought events per month over several decades. And what you can see is that the rates of both extreme drought and exceptional drought have increased dramatically over the course of the last 30 years. And this is important because obviously plants need water to grow, and drought impacts food security by limiting the impact or the availability and productivity of land. This has been documented across the globe. So this is from the Lancet Countdown US policy brief and references therein. And what's shown here on the left is crop yield potential for maize, corn, winter wheat, spring wheat, soybean, and rice, the main staple food crops for most of the world. And what you can see in looking at these graphs is that crop yield potential continues to follow this consistent downward trend, where it's relatively minor with rice, about a 1.8% decline. The declines with maize and soybeans exceed 6%. And importantly, the way this translates is that for basically every degree of temperature increase, there was a 1.4% global increase in the risk of severe food insecurity in 2014. And when recalculated in 2019, that risk was 1.64%. So we're seeing that the risk of this temperature rise seems to be amplifying over time. This phenomenon is not just restricted to land-based crops. In 2018 to 2019, nearly 70% of countries had increases in average sea surface temperatures, reflecting an increased threat to marine food productivity and security. And importantly, climate change doesn't just impact the availability of food, but it also decreases the nutritional value of those important foods. So less protein content, less vitamins, less minerals per gram or kilogram of foodstuff, suggesting that nutrition as medicine may be either less available, less potent, or both as the climate change continues to spiral. This risk amplification also includes other health risks beyond nutrition. So one thing that may be a little less obvious is that climate change increases the risk of other forms of pollution in addition to air pollution. So you may have seen this story in the New York Times a few weeks ago that talked about the Great Salt Lake drying up and the impact of that on the local community. And the reason that this is significant is that the Great Salt Lake harbors agricultural pesticide runoff, it harbors heavy metals like arsenic, uranium, and as the lake dries up, that exposes the seabed to geologic forces that turn it into dust, and that dust then exposes the local population and actually can spread great distances. So increasing the exposure to environmental toxicants as a consequence of local warming and drying out of the lake. This phenomenon is not restricted to Utah. And so this is something that has been seen in Central Asia as well, when agricultural policies in the former Soviet Union led to the drying of the Aral Sea that's led to exposure to toxic dust in communities in Central Asia as a consequence of the Aral Sea drying up. So this is a phenomenon that potentially has risks across the globe. And then something that doesn't exactly fit with human health as directly as this temperature is bad, but is certainly a threat multiplier, is the fact that our health infrastructure is susceptible to climatic factors. So this is something that has come up with discussions with business leaders, and that is that healthcare requires physical infrastructure, and that physical infrastructure can be damaged by extreme weather events. This can be as simple as a loss of air conditioning from power failure to having to evacuate hospitals because of wildfires. In this analysis that was published just a few days ago, the economic impacts varied from as little as $28,000, which is not that little, to as much as $22 billion. And this included things like building damage, closures and evacuations, delayed procedures and overtime. And so it's important when we think about health that we think not just about what the climate is doing, but how the climate change is actually impacting our ability to care for patients. As an aside, I'll say that the healthcare system itself accounts for about 10% of greenhouse gas emissions. So certainly they have some work to do. We certainly have some work to do to clean up our own act. But certainly thinking about the vulnerability of our healthcare system is an important aspect of urban planning as we try to build resilient communities. Okay, and then today I added this slide today because this vulnerability of health infrastructure is something that just is completely immediate at present, thinking about Hurricane Fiona taking out power in Puerto Rico. So the impact on individual health is devastating. And it's not just those infectious diseases, but I've spent the last few hours just sort of thinking about these folks who are dependent on insulin, which is a medication I use all the time for my patients. It needs to be refrigerated. The loss of power renders the medication, which is life-sustaining in many cases, unusable. My sister-in-law is currently on oxygen, and thinking about the loss of power and the inability to get oxygen to patients who are dependent on it amplifies sort of the health vulnerability imposed by these extreme weather events, which again are occurring with greater frequency, and the magnitude of what's going on in Puerto Rico is just simply heartbreaking. So I just wanted to bring that up as another form of vulnerability. So the individual health infrastructure or the casual health infrastructure that maintains life for many people. The other important thing to recognize from a health standpoint is that climate change is a driver of health disparities. So I really like this quote from Bill McKibben, the climate scientist, who wrote in The Nation in 2018, "All it takes is a record rainstorm to find out who lives at the bottom of the hill." So this was in reference to Hurricane Harvey that hit Houston. So as you know, Houston is the petrochemical capital of the United States. It was hit with Hurricane Harvey, causing mass flooding that led to a number of different industrial accidents that led to a variety of exposures in communities surrounding these facilities. So it doesn't take much to know which communities are actually affected by these extreme weather events. We can just look at the news, and we know that the communities that are principally affected by this are those that are low income, non-white, and generally communities of color. This is a fact that's been outlined in a number of different ways in the last few years. This is from the Center for American Progress that just is specifically talking about heat stroke and health risks associated with extreme heat, noting that there are certain populations that are specifically vulnerable, including low-income populations, communities of color, the elderly, as well as those with health conditions, and those working in jobs that don't allow for adequate protection. This includes agricultural workers, firefighters, and those who are particularly susceptible to unique local environments, including urban heat islands and those living in prisons and jails. We saw this ourselves in Chicago in 1995. When we look at the distribution of heat-related deaths in 1995, you can see aggregation of those deaths in communities of color across the city. And I just use this as an opportunity to plug the movie Cooked, which basically talks about this phenomenon and the sociological forces that have led to the disproportionate impact of heat on deaths in Chicago. But honestly, if you look at this map, it would be diabetes-associated mortality. All sorts of different things are associated with segregation in the city and how we invest in infrastructure and communities and people and education and et cetera. All right. So that's hopefully the end of no, it's not really not the end of the depressing part. Okay, so one of the things that I wanted to leave you all with is sort of how we take this knowledge and turn it into action. And this is really where NEST is uniquely situated. So when I think about knowledge to action, we think about like things that individuals can do, which we can talk about, global action, which is farther from our power, and national action, which tends to wax and wane, but local action where we have the opportunity maybe to affect the greatest change. So the biggest thing, at least in my involvement with NEST and in Naperville, is to recognize that, you know, we as a community disproportionately contribute to climate change through our disproportional use of coal-fired electricity. So this is something that has to change. It's critical that it changes. This is, as an affluent community with the capacity to buy more air conditioning, what we're doing is we're contributing to health disparities by driving the burden of heat on other communities. But our own community itself, it will also be affected. This is a global phenomenon. And then I include here some data from the Environmental Integrity Project, just to note that this burning of coal doesn't just drive climate change. It doesn't just drive CO2 emissions. It doesn't just drive rising temperatures. It also contributes significantly to toxic metal exposures through the generation of coal ash, and in groundwater around the Prairie State coal-fired power plant, groundwater levels of cobalt are 22 times higher than the safer level. Lead levels are 31 times the Illinois standard, and arsenic levels are up to 13 times higher than safe levels. So our consumption of this electricity not only is contributing to global warming, but it's also polluting groundwater around the communities around the power plant. So what does change look like? So the important thing here, as noted by those folks who did the infectious disease work, was that the goal is to stop producing greenhouse gas emissions. So this includes transitioning to 100% renewable energy, which must include maximizing local sources like rooftops. We need to electrify everything after we've moved to renewable energy, but likely before. We certainly have to end the use of natural gas. We need to build walkable communities that are supported by electrified public transportation in order to get people out of their cars. We need to disincentivize the production of fossil fuels for other purposes, including plastics and pesticides. And then the other thing that I think is really interesting is thinking about green infrastructure and how important it is to address stormwater and urban heat islands. When you go from the historic district to downtown Naperville, you notice a huge temperature change. And it's interesting how little green infrastructure we actually have. And this is something that would be worthy of further thought as we urban plan the future of Naperville. Again, given the susceptibility of hospitals and clinics to extreme weather events, we need to think about fortifying critical infrastructure. And then the other thing at the heart of all of this, which I think is absolutely critical, is we need to think about how we can build a mutually supportive community that thinks beyond the city limits and is committed to health and environmental justice, both here and throughout the region, across the country, and around the world. So luckily for you all, you've got some great folks who are working on these issues, including NEST and the Clean Energy Alliance of Naperville. We need to all be active and engaged with our leaders in order to really help them understand that really, our health depends on action to address climate change. I have here a few resources for y'all. The CDC has a website, Climate and Health. The Lancet Commission is great. It's full of great resources if you're interested in. There have been a series of them. The 2021 report provided much of the data that I showed you here today. And then if you're interested in the health justice aspects of it, there are a couple of great webinars and resources online that have been put together by the American Public Health Association and the Centers for Disease Control and Prevention. And with that, I will close, and hopefully I have ended on time. Thanks so much for your attention.